This is Debbie Bucher for Parkland College, and this is for the LPN to RN Transitions course. And we're using the text, The LPN to RN Transitions by Laura Claywell. And we're going to be going over Chapter 4 in the book, and it's distinguishing the RN role from the LPN role. So you've all decided to. And I think it's important to kind of stay humble too, and again, don't forget where it is that you all started from. Certainly, I think your students are accepted more easily when they just really are saying, hey, we just want to learn as much as what we can learn. Yes, I do have some experience, or yes, I do have my LPN, but I really want to learn what an RN does, and I want to be involved in whatever it is that you're doing as a nurse so that I can learn and evolve. And also, as your role as a counselor, many times, particularly if your patients are having a hard time navigating the healthcare system, or maybe are unhappy with the healthcare system, I think a lot of times as a nurse, really, sometimes it's the psychosocial aspects that really come to play even more importantly than maybe some of the physical aspects of someone's illness. And that's something that we want to remember, because I think sometimes patients are looking to us to stop and slow down and to see them for the person that they are. They're somebody's wife, mother, grandmother, father, brother, sister, aunt, that sort of thing, to recognize them in that role and to meet them where they are and just sit down with them and just even listen to them for 5 minutes, maybe explaining to you what it is that they are experiencing. I think that as a nurse, that's a really sometimes the psychosocial aspect is actually more important than the physical aspect of their care. Sometimes that's really all they're looking for from us as a nurse is just to listen to them, just to hear them, so that they know that you understand where they're coming from and that you do truly care. And the cool thing about nursing is, we are all about the science of nursing, but actually the art of nursing is, just as important as the science of nursing, and that's really kind of key, to not only provide that physical care, but to be able to provide that emotional care as well. And I think a good nurse is able to do that, and is able to recognize that sometimes the psychosocial aspect is really more important than the physical aspect, although that is important, of course, to help our patients get over their illness, or help them through whatever process that they are working through. And another role that we have, which is another major role I would say that we have as an RN, is being an educator. So we need to always be able to provide patients with the information they need so that they can make the best informed decision about their treatment, their care, their decisions, their different physicians, and that sort of thing. So uh, we do a lot of education, and we want to remember that when we are educating our patients, we also want to choose the best times to educate our patient too. If your patient's having a lot of pain and their family members aren't in the room, that's probably not going to be the best time to educate your patient on wound care, or maybe how to do IV antibiotics once they go home. You want to catch that patient when their pain is under control, when their caregiver or family member is there, because it's really important as you do education that not only the patient is there, but their caregiver or a family member, so that you've got two people hearing the same information, because your patient is really under a lot of stress when they're in the hospital, as well as with your families. And so chances are they're not going to remember very much of what you're educating them on, which is why when you do your education, you always want to provide written information to your patients and their families, because then they can look at that when they go home, and maybe they don't remember clearly what it is that we taught them, but if they go through the instructions that we provided with them, they're like, oh yeah, that's right, she did tell me that if I started having some oozing from my incision, or some redness, or a temperature, that those would be signs of infection that I would want to notify my care provider about. I remember that now. So that's really important that we do as an educator in our RN role. We also are a manager, seen as a manager of the patient's care. We are involved in supervising other members of the healthcare team in planning, managing, and coordinating care for our patients. And so that means that we are that we are aware of the interprofessional disciplines that are involved in someone's care, such as physical therapy, occupational therapy, speech therapy, social worker, any any or all of these areas, you will be working with and helping to guide the patient's care and supervising and having a good understanding of what goals that these other ancillary departments have when they're working with your patients. So it's really important that we are managing that care and that we know what is going on and the expectations of each other in that interprofessional circle. Also, we are seen as an advocate for our patients. We need to try to shield the patient and family from any harm, and we want to be complete and honest and provide complete and honest information to the patients and their families. And we also, again, when we advocate for the patient, we're in a sense, kind of standing up for the patient, recognizing that the patient does have rights and responsibilities as patients, and they have a right to autonomy and a right to self-determination. They have a right to make that decision with regards to their care, which is why we want to provide all the information we can, besides, of course, what the care provider is telling them. But more than likely, you as a nurse, you're going to have so much more time spent with the patients that they will be asking you questions. And of course, anything you don't feel comfortable with, you might want to refer maybe to your supervisor or refer back to the care provider, maybe to go over. So, as a member of the healthcare team, we collaborate with physicians and other personnel, healthcare personnel such as physical therapists, social workers, pharmacists. I think I failed to mention pharmacists earlier. So we collaborate and we're all working towards a common goal, which of course is the best health that we can get for our patients. We also are seen as a change agent. So we may be in the role where we may want to make a change, or we maybe need to take that as a role where we're kind of stepping out and maybe taking a chance of maybe doing something differently. Um, all the while making sure that you're talking with your team and talking with your supervisor and manager as far as making sure that you are doing all the right things. But if you do come up with something, evidence-based practice is so important these days that if you see something, you're researching something, and you feel like maybe something could be done a little bit differently, that you feel maybe is a better way of doing it, then that's up to you to be a change agent and to go talk to your supervisor and manager, but maybe about making a change. That's important to do in that role. Um, as a change agent. You're also a role model. You're a role model where you are working. You're a role model to the other LPNs you're working with. You're a role model to anyone in the healthcare team, really, as you continue on your role as a registered nurse. You can also be a part of different groups and associations, such as the American Nurses Association. There's also a code of ethics that we follow as a nurse so that we behave in a caring, conscientious manner and that we always place the patient first. That's really important. And it's also important for our patients to know that we're putting them first as well. And of course, as we graduate and start working as an RN, we want to continue to be a favorable and positive role model to those that we are working with. And never forget where you all started from as a student. I think sometimes you hear the phrase, nurses eat their young. I think sometimes the nurses do that and they don't remember where they started as a student. I think that's really important so that you can be the best role model that you can be and taking students underneath your wings once you graduate to help them learn as much as what they can learn. And in a way, you're also a mentor to these people. A mentor is your trusted advisor. So you will be looked to when you precept or when you counsel and teach and educate people. You are certainly looked as a mentor, and particularly if you're acting as a preceptor in a healthcare organization, that's really important that you are a positive role mentor um, to the other nurses and to the other students that you're working with. And again, we've already talked a little bit about evidence-based practice. It's really important that you, as a nurse, can research and stay up on the best way to do things, and be somebody that's a researcher and a change agent for the people that you are caring for and working and working with, and really research, continues to help us find more efficient and more effective ways to provide care, and helps us to better understand the nature of nursing, and what we can do to assure the patient is receiving the best care that they can receive. And then also, you can also be seen as a nursing entrepreneur. Some nurses have formed their own businesses in healthcare, such as freestanding clinics, home care agencies, consultants, educators, and advisors to organizations, and that sort of thing. So there's many different roles that you can do, and you may be an entrepreneur. You may decide that you may want to open up your own company once you graduate. So it's really important that you understand these 11 elements that make up the role of the registered nurse, and you're going to be taking on many of these roles in everyday practice as a nurse. So it is important that we remember that we are a care provider, a counselor, an educator, a manager, a patient advocate, a collaborator, a change agent, a role model, a mentor, researcher, and lastly, an entrepreneur. So some differences between the LPN role and the RN role. As far as autonomy and independence, an LPN may function under the guidance and direction of an RN or another care provider. So you don't practice as autonomously as what you will as an RN. An RN will function autonomously and independently when assessing any number of things that you do with your patients. And also included in that is health teaching and health promotion, health counseling related to mental health addictions or chronic illnesses, restorative care, as well as you will have a role in palliative and hospice care, wound assessment and interventions, again, patient education, which is really important, chronic pain management, also public health. So there's, many different roles that we play as an RN, um, um, and also of course, educational level. Certainly as an LPN, you're learning how to use your critical thinking skills and assessment skills to provide the best care. And I think you just expound on that role as an RN. I think you expound and enhance your ability to do a really good assessment, and you continue to hone in and do even better with your critical thinking as you are helping the patient and to plan, manage, and evaluate their care. And again, you both, as the LPN and the RN, are using your critical thinking skills. I think you just take them to the next level as an RN. And same way with assessment skills. You guys are building upon your assessment skills, and I think your assessment skills will become even better and more important as you practice as an RN student and then as an RN. Of course, we have legal and leader responsibilities. We may be in a team leader role, a charge nurse role, a nurse manager, or maybe even a nurse administrative role. And so each of those functions with a role of authority, and we want to be providing the best care while we are making sure that what we are doing is, of course, the best thing, and that is legal, of course. And we have that responsibility. IV therapy, many of you may be practicing in a facility where you are able to do IV medications, IV piggybacks, or IV push medicines, or you may not be. Sometimes in different facilities, they will have you attend like a medication course, in which case they will test you out on the IV medicines and you may be able to do it, or you may not be able to do it until you do become and come across it in your clinical as an RN student. So you will be the overseers of these IV medications, including blood transfusions, which we do. We see blood being transfused, really quite often on the floor in the hospital. You will continue improving on your communication skills, which is really important. RNs are again exposed to theory. I know you are. You brush on that as an LPN too, but you are learning even better communication patterns and therapeutic communication with your patients that you're caring for. And then you recognize that there may be some behavioral differences that might affect communication. And again, we're seen as a teacher, but also we are we are learning every day as well. I think every day I learn something new. So we are, really you become lifelong learners. I think not only as an LPN but as an RN, and as you take on different roles and different and go back to school to and maybe obtain your BSN and your master's, which many of you will. So. And I think, you'd look more into maybe as an RN, maybe why things are happening the way they're happening and why it is you're seeing what you're seeing. I think you just kind of, you're able to put it together maybe a little bit easier. And we want to make sure that we are providing for a holistic plan of care for our patients. And again, make sure that we are communicating very well with our patients as well. Very important. And in your educational preparation, you all have chosen to first start as an LPN, which I think is wonderful. And maybe some of you are currently practicing as an LPN, and you're gaining experience, which I think is really important. But there are different educational routes that you can take. One is the LPN, and then you're bridging over into the RN program now. Another one is you could, or some people may decide to go to a 4-year school and obtain your bachelor's in nursing right away, or you may some of you may have looked at or maybe or have heard about diploma programs. The diploma programs used to be very, very popular, but now there are not as many in the United States. I think there's more ADN programs now, and again, the BSN programs as well. But so there's probably about less than 70 diploma programs in the United States. They're really starting to kind of fade out a little bit more, but many different ADN uh, offerings are taking place at different junior colleges, not only in the state of Illinois, but in the United States itself. So, but no matter how no matter how you come across your education, whether it's a ADN program or a BSN program or a diploma program, it doesn't matter. Everybody takes the same RN NCLEX examination. So that's important to remember. So, um, and yeah, again, the different types of educational programs I just talked about, and the advanced RN educational programs would be besides your BSN, going on and getting your master's degree in nursing. Maybe your dream is to become a nurse practitioner, or maybe you'd like to teach. And then also some of you may go on and even receive your doctoral degree, which I think would be a wonderful thing if you decided to do that. So, but there again, no matter what your preparation is for a new licensure as a nurse, ADN, BSN, or diploma, again, everybody takes the same NCLEX exam. So the ADN program, just a little history here, the ADN program actually began in 1952, and as of 2008, there were approximately 850 ADN programs in the United States. And of course, these programs help prepare people to work in acute and long-term care settings. But some of these programs may not include community care or, population health. Some students may not get the critical care experience. You guys will get the population health, the community health, and you also will get the ICU experience as well, which is really good. So, and then the first BSN program began in 1919, actually at the University of Minnesota. And then there's about 500 master's programs in the United States. There's probably more by now. And then PhD programs, not sure exactly how many there are, but there are quite a few. So again, your PhD programs focus on research, and there's also again besides nurse practitioner that you could go on to become. You could become a midwife or a nurse anesthetist as well, and all those, of course, you need to have higher educational degrees. And if you're returning to school after you get your master's and you're working on your doctoral degree, most of those programs are preparing nurses to become teachers, researchers, and clinicians who promote a higher specialized profession. So, and in the National Council of State Boards of Nursing is who is looking at the NCLEX test plans. And so they redo the test plans, I think, about every 3 years, I believe. So that's important that we stay abreast of the different changes in the blueprint of the NCLEX, which we wanted to make sure that we are hitting the areas that you will be needing to know for your preparation for your NCLEX test. Now, as you continue on in your schooling after you get your ADN, whatever bachelor program that you're looking into, you want to make sure that that program is indeed accredited, because if you would attend a BSN program that's not accredited and you apply to, maybe you decide you want to get your nurse practitioner degree, you're applying for schools for your master's. If the program that you graduate with your BSN is not accredited, then they may not accept you into that program. So it is really important that as you continue your education as an RN, that you are indeed going to school where they are accredited. So that's probably the first thing I would look into is, are they accredited? If they're not, I would not go there. That's just my opinion. I just think you open yourself up for potentially not being able to move on and move forward because you did not attend an accredited program. So an accreditation, it's intended to demonstrate to the public that a nursing program is meeting national standards and national requirements and criteria. One of the accrediting bodies is the Accreditation Commission for Education and Nursing, the ACEN, which is what we are accredited on as well. And as a matter of fact, we are going to be doing our re-accreditation in February of 2020. The first week of February actually is when they are scheduled to come. So it's a pretty exciting time for us, but it's also, I must admit, a little bit nerve-wracking though too. So, but very important that we continue to maintain that status of being an accredited and good program. So, and then there's also different certifications, and I would encourage you that after you graduate, you get experience, that you do look to maybe become certified in your area of nursing that you are focused on at the time. So I think that's really important. So many nurses can become certified in their areas of expertise, such as infusion nursing, which I do have my certification in infusion nursing. I think I've had that for about 23 years now. I continue to go to conferences every 3 years so that I get the CEUs I need to maintain that level of certification as an infusion nurse. There's also certifications in med surg. There's certifications in critical care. There's certifications in wound care as well. So I think there's, I'm not sure, 30 maybe or more different certifications that you can do, which I think is really good. So I would encourage you all to do that. There are also different professional nursing organizations that I would recommend that you would take a look at and potentially join. I do belong to the American Nurses Association. There's just a lot of education and professional development, and you're just staying abreast of the new things that are out there. So I would encourage you to take a look at that. It represents about 3.1 million registered nurses in the United States, and advances the profession of nursing by helping to foster the high standards of nursing practice, promoting the rights of nurses in the workplace, projecting a positive and realistic view of nursing, as well as participating in lobbying efforts on the healthcare issues that affect nurses and the public. So I think that's really, really important that you take a look at and maybe belong to a professional organization such as the American Nurses Association. So there's also other organizations, like I also belong to the Nurses Infusion Society as well. And if you want to take a look at the American Nurses Association website, it's the address is www.nursingworld.org. So take a look at that. And of course, we all have a scope of practice. There's a scope of practice that you all follow as an LPN. There's also going to be a scope of practice that you will follow as an RN. So each state has a Nurse Practice Act that you need to be familiar with. I would take a look at that. Now, I think that's important that you understand what that is. And of course, that just tells you what it is that you can do to practice, and you always want to stay practicing within your scope of practice. So again, it's defined by the individual state nurse practice acts. And there's also individual state boards of nursing, which are located within varying government organizations at the state level, which they exist to protect the consumers of nursing care and by helping to regulate the the profession. So, and the ANA has also publicized the scope and standards of practice. And again, it also addresses the scope of practice and delineates the practice and professional performance standards and measurement criteria for RNs. And there are different, there's 6 standards of practice that we follow as an RN, and that is we assess, we come up with nursing diagnoses as well as outcomes that are individualized to help that patient meet their best possible outcomes that we can help them attain. Planning, deciding what interventions that's going to be the best for that patient, and then implementing those interventions. And then evaluation, after we provide those interventions, are we getting the outcomes that we are wanting to achieve through our 6 standards of practice. There's also 11 standards of professional performance that we want to make sure that we are following as an RN. And of course, ethics. And ethics is a pretty important and serious thing that we want to uh, be aware of while we are providing care. You are all going to experience an ethical situation at some time or another, and you always want to make sure that you're doing and deciding what is right, what is the best thing that I can do for my patient, what is the best thing I can do for my patient so I'm not harming or putting my patient in harm's way. And you don't want to do the wrong thing. So you always want to operate on doing what's best for that particular patient in that particular instance. You also want to be culturally competent and understand the culture that you may be caring for people with different diverse cultures. If you're not maybe understanding a different culture, it's important that you know maybe how they view medicine and nursing care in their culture. So even just Googling somebody's ethnicity to see what their, how it is they perceive their health and that sort of thing. I think that can make a big difference and shows that person that you respect where they are coming from. Again, we need to communicate. We need to be communicating clear and precisely. We also want to make sure that we are communicating therapeutically with our patients while providing empathetic and genuine positive care. And we also want to remember we want to collaborate well with the patient and family, but also other members of the interprofessional team. Again, your therapy, your social workers, that sort of thing, all being respectful of one another. The registered nurse is seen as a leader in the practice, in the profession, as well as in your practice. And the registered nurse, you're continue to gain knowledge and competency as you work as an RN, and you're always wanting to focus on your professional development too. You want to stay on top of your nursing practice and what's the best way to do things as a nurse, which is what you're going to be doing as evidence-based practice. Make sure you understand what evidence-based practice is and the research component to that, and just making sure again that you're staying up to date with the best way to do things. And maybe you're the change agent on your floor, and you've maybe decided that maybe there's something a different and better way, and you have researched it, and you have the evidence to support maybe making that change in the practice, which is important that you talk to your manager with regards to that. You're going to maintain a high quality of practice in your nursing practice, and you also want to evaluate what you're doing and making sure you're doing the right and best things for your patients, and making sure that you are following standards and guidelines as well as rules and regulations. That's very important. And again, you're providing leadership in the professional practice setting, and you are a leader, and you know how to find resources and how to utilize resources to help the patient meet their best outcomes. And also you would look at the environmental health too. How healthy is the physical environment, and what's the patient's environment that they are coming from. Important to note that. So question, which statement indicates that the nurse correctly understands the 11 standards of professional performance? One of the 11 standards is what? And if you said number 1, communication, that is indeed correct. It's extremely important that we maintain good communication with our patients as well as with the healthcare team that we are working with. Now, there is a multi-state licensure. There's a nurse licensure compact that was developed by the National Council of State Boards, which it helps nurses to practice in neighboring states without having to take or retake a test or uh, pay for another a license. So the nurse is licensed in one compact state, but is able to practice in another. And of course, you must adhere to the laws of that compact state, and this requires that the nurse stay abreast of any changes to multi-state licensure. So if you are doing this, you want to make sure that you are staying on top of it. This allows the nurse in compact states to work in other compact states without having to obtain a license in that state. So it makes it a little bit easier, and it helps to allow nurses to quickly cross state borders and provide vital services in the event of a disaster, which is very helpful when they can do this. And it just makes practicing across state borders more affordable and also much more, really much more convenient. So that's something that's good that they are doing. So the LPN functions under the direction of an RN and cares for patients with maybe more common health problems or illnesses. And as an LPN, you are performing basic assessments and data collection, and you have input into the patient's plan of care, but the RN will actually be the one managing and deciding exactly what that plan of care will be, but using the LPN's input, which is very, very important. So. And Florence Nightingale believed the role of nursing is to put the patient in the best condition possible for healing to take place, which of course we would all agree with that. And protection, promotion, and observation of health and abilities. We want to help prevent illness and injury and hopefully help to alleviate suffering through the diagnosis and treatment of human response. And as well as we always want to continue to be an advocate in the care of our individuals, families, communities, and populations. And Virginia Henderson stated that the unique function of the nurse is to assist the individual, sick or well, in the performance of those activities contributing to health or its recovery that he would perform unaided if having the necessary strength, will, or knowledge, and to do this in a way to help gain independence as rapidly as possible. So we're all about trying to help our patients with the best outcomes to be able to retain their independence or at least get back to their previous baseline that they were prior to experiencing this illness. So as an RN, there's 3 kind of primary roles that you play after you graduate from the ADN program, and that is you are a provider of care, you are the critical thinker, you're the teacher, you collaborate, and you're a patient advocate as well as being culturally competent. The RN prioritizes care, manages care, delegates care, is a decision maker, practices legally and within ethics, and works with all disciplines to provide the best care for the most optimal outcomes. Provider of care and RN, the RN provides competent care to individuals and their families and communities. So again, being a teacher, collaborator, patient advocate. And the RN is a delegator and decision maker and practices within legal and ethical processes as well as managing and prioritizing care. The RN also acts as a role model and gives feedback to other members of the healthcare team. And the RN assumes and accepts accountability and professionalism and is responsible for their actions. The RN sees the patient as a whole and also works within the team. And the American Nurses Association has found 10 domains of what a nurse should look like as they practice. Just going back a moment here, I'm not sure that this was recorded, but making sure that you're looking at the American Nursing Association agenda for the future as far as leadership and planning, delivery systems, legislation, regulation, and policies, the professional nursing culture, recruitment and retention, economic value, work environment, public relations communication, education, and diversity. And there's 4 key elements: leading change and advancing health by the American Nurses Association and the Institute of Medicine. Nurses should practice to the full extent of their education and training. Nurses should achieve higher levels of education and training through an improved educational system that promotes seamless academic progression. Nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States, as well as nurses must be in an effective workplace. Planning and policymaking require better data collection and information infrastructure. And now this does include this. This does now. This is now the into the lecture for Chapter 4 in the LPN to RN transitions book. Thank you.